Hey there, and welcome to today's Explainer. We're diving into a topic today that honestly brings up a lot of silent worry for people, and that's reproductive health. If you've ever had a doctor look at a chart and say the words ovarian cyst, or maybe you're in the middle of a fertility journey right now and you're just feeling kind of anxious, I want you to take a deep breath. You are in exactly the right place. Today's Explainer is designed to be a totally supportive patient guide. We're drawing straight from the experts at RFT Fertility Clinics, and our goal is simple. Let's replace that fear with some solid knowledge, cut through all the medical jargon, and give you a really clear, comforting look at what's actually happening inside your body. Now, before we even touch clinical definitions or treatment plans, I need you to hear the single most important takeaway from our source material today. Ready? Most cysts are harmless. Seriously, I know when we hear the word cyst, our brains just immediately jump to the absolute worst-case scenario, especially when we're worrying about our fertility. But the biological reality here, the vast majority of these are completely benign. So keep that reassuring little fact right in the back of your mind as we go through everything else today, okay?
All right, here is our roadmap for today. First, understanding ovarian cysts, then the types of cysts, spotting the symptoms, and finally, fertility and treatment next steps.
Let's jump right into Section 1, Understanding Ovarian Cysts, which is really our baseline of reassurance.
Okay, so getting a solid grip on the basics is absolutely the best way to quiet all that anxiety that comes with the unknown. So let's just demystify this. What actually is an ovarian cyst? Well, according to the clinical data from ART Fertility Clinics, it's just a fluid-filled sac-like structure in an ovary. And that's literally it. I know, it sounds super mechanical and a bit weird when you say it out loud, but honestly, it's just biology doing its thing. It isn't necessarily some scary anomaly. It's really just a tiny little pocket of fluid that developed inside the ovarian tissue. When you break it down into plain terms like that, it feels a whole lot less intimidating, right?
But there's a balance we need to strike as informed patients. Even though we know most of these little fluid pockets are totally harmless, proper diagnosis and close follow-up are absolutely essential. This is just standard, safe medical procedure. So if your doctor says, hey, let's keep an eye on this, or they schedule a follow-up ultrasound, they aren't doing it because they're freaking out. Not at all. They're doing it because close monitoring is the gold standard of care. It's just about being proactive instead of reactive.
Moving right along to Section 2, Types of Ovarian Cysts, where we start categorizing the unknown.
So picture this, you're sitting in the consultation room and doctors are just throwing out all these different medical terms. Let's mentally organize those categories right now so you never feel out of the loop. Because once you know what a cyst is, the next natural question is, are they all the exact same thing? Do they behave the same way? Well, the short answer is no. And understanding the difference between them is super important for understanding your own reproductive health. The clinical landscape is basically split into two main camps. First up, we have functional cysts. These are by far the most common type. And here is the really reassuring part. They actually grow as a totally normal part of your menstrual cycle. Seriously, they're just a byproduct of your body doing exactly what it's supposed to do every single month. On the flip side, we have non-functional ovarian cysts. Now, these are much less common, and they develop completely outside the normal function of your cycle. Seeing the contrast like this is great, because it reminds us that the most common cysts are literally just tied to our natural, everyday biology. Let's look at a couple of specific names you might actually hear, just so you're prepared. You might encounter terms like corpus luteum cysts or hemorrhagic cysts. Now, I know hemorrhagic sounds like an incredibly scary word, but remember those two camps we just talked about? These fall squarely under that functional category. They are directly tied to your normal cycle. So if you see these clinical names on a chart, please don't panic. They're simply the specific medical terms for the most routine, everyday types of cysts.
All right, Section 3, Spotting the Symptoms, and really learning to listen to your body. Now, listening to your body is crucial, obviously, but I also know firsthand how stressful it can be when you're suddenly hyper-aware of every single little twinge. If you've been diagnosed or even just suspect you might have a cyst, your brain zeroes right in on what you're physically feeling right this second. So what are the actual physical markers the medical guidance tells us to watch out for?
Okay, drumroll please, because the most crucial point to remember is that very often, cysts are completely symptom-free. You could literally have a functional cyst doing its thing, resolving itself right now as you're listening to this, and have absolutely no idea. I want to pause and really highlight this because it is a huge relief for so many patients. Feeling totally fine, experiencing zero pain or disruption, that is actually incredibly common, even if a cyst is sitting right there.
However, we have to talk about what happens if a cyst grows very large, what the clinical notes actually refer to as a huge ovarian cyst. When they get to that size, they can start creating physical pressure.
First off, there's just the physical space it takes up, which can cause bloating, inflammation in your abdomen, or just this weird, general heavy sensation. Second, because of exactly where the ovaries sit in your body, a large cyst can physically press against your bladder, making it difficult to pass urine. And finally, there's the pain aspect. This might show up as a sharp pain localized right on one side of your lower abdomen, or it could mess with your cycle, leading to really painful menses and irregular bleeding. Look, if you're experiencing this kind of grouping, physical pain, urinary pressure, or menstrual irregularity, it's simply your body waving a little flag, asking for that standard follow-up care we talked about earlier. Let's head into our final section, Section 4, Fertility and Treatment Next Steps. This is the path forward.
So, we've defined what this is, organized the types, and gone through the symptoms. Now let's talk solutions. Let's say an ovarian cyst is complex, or maybe it's linked to an underlying condition like PCOS that's actively messing with your fertility. The good news is you have some highly advanced options over at ART Fertility Clinics. For example, they offer in vitro fertilization, or IVF, which is amazing because it bypasses the fallopian tubes entirely by fertilizing the egg in a lab. Then you've got ICSI, intracytoplasmic sperm injection. That's a super advanced technique to overcome male infertility factors by directly injecting a single sperm right into an egg. And finally, genomics, specifically things called PGT-A and PGT-M. These allow doctors to actually test embryos for genetic disorders before they even implant them. The big takeaway here? A more complex diagnosis is absolutely not a closed door. It's really just a pivot toward these incredibly sophisticated, super targeted treatments.
And the best part is, you don't have to figure this out alone. Our source material points out that world-class expert care, led by top specialists like consultant reproductive health expert Prof. Dr. Human Fatemi, is incredibly accessible. ART Fertility Clinics are located all across the UAE, in Abu Dhabi, Dubai, and Al Ain, meaning patients have direct local access to the exact specialists who can map out a fertility journey tailored specifically to their unique body and diagnosis.
Which brings us to our final thought for today. You know, we started this explainer aiming to replace anxiety with real, actionable clarity. We learned that most cysts are harmless, that functional cysts are literally just part of your normal monthly cycle, and that advanced treatments are totally there for you for the more complex cases. So I'm gonna leave you with this. Could understanding your symptoms and realizing that you really don't need to be afraid of them be the empowering first step you need to take control of your reproductive health and protect your fertility? Thank you so much for joining me for this explainer. And remember, the more you know, the clearer the path forward becomes.